This is Mr. M.A. Mr. M.A. was admitted to the hospital with endocarditis due to drugs and developed heart failure after that. So today he's being discharged home, and I'm going to go over some discharge instructions and education about heart failure. Our target audience is going to be IV drug users, and then heart failure is usually the elderly, so the same teaching could be used for both. Some basic heart anatomy. The heart is a muscle that supplies the body with oxygen and blood. The tissues, muscles, and organs all need blood and oxygen to function properly. There are 4 chambers in the heart, and all work together to pump the blood supply to the body. Heart failure. It's a condition when the heart is unable to pump enough oxygenated blood to meet the needs of the body's organs. There are several different types of heart failure. For this, I'm just going to discuss heart failure as a whole and not go into each individual type. Causes. Some of the causes are heart disease, high blood pressure, infections of the heart, chronic lung disease, drugs, too much sodium intake, and diabetes. The treatment for your heart failure will include restricting salt and fat in your diet, stop smoking, quit drinking, proper rest, limiting fluids, controlling your blood pressure, and stopping drug use. Most importantly, treat the underlying cause, in your case, antibiotics for the endocarditis. Medications. The doctor has written you prescriptions for some new medications that we have started here in the hospital, and you will continue them at home. These medications include metoprolol, a beta blocker to reduce the workload of the heart by slowing it down, and also Lasix, a diuretic to decrease the amount of fluid in the body, lisinopril, an ACE inhibitor that will decrease your blood pressure and decrease the resistance of your heart, and then a prescription for the antibiotic that you started here in the hospital. How to live with heart failure. Heart failure is a lifelong illness, but there are habits and treatments that can make living with heart failure easier to manage. First thing, weigh yourself daily, at the same time using the same scale with the same amount of clothing. Just get in a habit to do this either first thing in the morning or whatever your regimen is, just continue that. Take medications as directed. Report any adverse effects such as rash, dizziness, and excessive cough. Remember to change positions slowly. The medications that you're on decrease your blood pressure and your heart rate, and may cause you to become dizzy if you change positions too quickly. So just go from lying to sitting to standing in a slow fashion. Attend all scheduled appointments, making sure to bring log sheets with you to the doctor. And I've got these here for you. One's your blood pressure sheet, activity tracker, and your sodium and fluid intake. If your condition changes, make appointments to see your doctor. Do not wait until symptoms are severe to be seen. Next, stop smoking. Just kick the habit. Your physician has given you a list of smoking cessation options. Limit your salt. Keep salt intake to 2 grams per day. Skip adding salt while cooking and rinse canned foods. Be sure to read all labels. Just look for the sodium intake on the labels. Fluid restriction. The doctor has put you on a 1-liter fluid restriction. And on one of your log sheets, you can keep up with your total fluid intake. And a good option when you've already reached your 1 liter is sugar-free gum and hard candy. This will help keep your mouth moist without adding any extra fluid. Don't drink alcohol. Exercise. Walk 5 to 10 minutes daily. Keep regular schedule and keep legs elevated while sitting. This helps with the swelling. When going on long car trips, remember to stop every couple of hours and just get out and walk and change positions. Avoid anxiety. Anything that causes additional stress on the heart should be avoided. And lastly, stop using drugs. Drugs are the reason you're in the situation that you're in, so just stop them altogether. These are some signs and symptoms that you should report to your doctor. Weight gain of 2 to 3 pounds per day, or 5 pounds in a week. If performing your normal activities causes shortness of breath or chest discomfort, increase in the amount of swelling in your arms or legs, which means that you're retaining the fluid. If you're using more pillows when sitting in order to breathe comfortably, and what this means, if you usually put 1 pillow behind you while you're sitting and all of a sudden you need 3 pillows behind you in order to breathe comfortably, then something may be going on. A wet cough or frothy sputum, And as always, let your doctor know if there are any change in conditions. Mr. M.A., do you have any questions?
No.
Okay, well that wraps up our discharge instructions. Thank you.